Today we're going to talk about an alternative protocol for erectile dysfunction. Now I just need to get something out of the way. When you look up erectile dysfunction in Wikipedia, this is what it says. It says the Food and Drug Administration does not recommend alternative therapies to treat sexual dysfunction. Many products are advertised as herbal Viagra or natural sexual enhancement products, but no clinical trials or scientific studies support the effectiveness of these products for the treatment of ED. So I'm going to tell you right now, that is absolutely a lie. If you look up randomized controlled studies, human studies on alternatives to Viagra, you will find quite a few. In fact, I'm going to put a handful down in the description so you can check them out. These are natural alternatives that show significant improvement for erectile dysfunction. There is a lot of research. I think that statement is really protecting the drug companies because they like to sell Viagra. And if you have erectile dysfunction, you're going to be very happy because I'm going to show you quite a few things to improve that situation. First question is, what is erectile dysfunction? And is it the same as lowered testosterone? No. Testosterone controls more libido, your muscles, especially as you age. If you have enough testosterone, your overall mood will be better. If you have low testosterone, you'll be more depressed or have more anxiety. But you can have normal testosterone and still have erectile dysfunction. Today, we're going to show you what to do for this condition right here. Erectile dysfunction is one of the earliest signs of vascular disease. That's right. If we take a look at your arteries, the inside of the arteries are lined with this single cell layer called the endothelial layer. And so what erectile dysfunction is, it's a problem with the vascular system. That layer of cells is not working correctly. There's certain things in your body that signal the relaxation of your arteries to open up, vasodilate, and allow blood flow. And I'm talking about blood flow into your private parts. That molecule is called nitric oxide. In animal studies, when they completely blocked nitric oxide, there was a complete failure with erections. Nitric oxide can lower or inhibit testosterone. And there is some truth to that. But there's also some truth that nitric oxide can increase testosterone. So how can you have these two conflicting ideas? When you have super high levels of nitric oxide, that can inhibit testosterone. When you have mild or normal levels of nitric oxide, then you will trigger the increase of testosterone. And so with all the natural remedies and lifestyle actions I'm going to talk about, you're not going to get a massive high level stimulation of nitric oxide. But you do get a massive level of nitric oxide when you're taking Viagra or when you get chronic inflammation. The nitric oxide comes in there and acts as a substitute for oxygen. So in other words, you don't have to worry about nitric oxide inhibiting your testosterone. Check this out. When you're 20, you have a full amount of nitric oxide, right? You have a lot of nitric oxide. It's working fine. You can get erections. You have no problem. And then when you get into your 30s, that nitric oxide starts to decrease a little bit. So now you're at 85%. In your 40s, you go down to 70%. At 50, you're at 55%. At 60, now you're down to 40%. And then at 70, you're down to 25%. Now that is a problem. We no longer have the ability to relax the vascular system to allow blood flow. And so with erectile dysfunction, the person either cannot get an erection or they can't maintain an erection because they don't have this nitric oxide. So then what people do is they take something called Viagra. But the question is, does Viagra increase nitric oxide? No, it actually doesn't. It gets rid of something else that causes this degradation or erasing of nitric oxide. So then you can maintain more nitric oxide in your system for a little bit, okay? The problem with Viagra is it does come with some minor complications, headaches, flushing, low blood pressure. But there's some more serious ones like a heart attack, a stroke, permanent hearing loss. Another side effect is when you're looking at things, everything looks blue. And prolonged erections that can lead to damage in your penis. Other than that, you're perfectly fine. This is why I'm doing this video, to give people alternatives, things that are safer things that potentially can help you that don't give you a bigger problem than you're trying to solve. And the problem is when you get older, you're losing your muscle mass because of this testosterone. And testosterone also helps decrease inflammation. It helps your insulin work better, helps your blood sugar. It's even involved with protecting you against bone loss. But the big thing that people think about with testosterone is libido, interest in sex. What we're dealing with as we age, when we lose this nitric oxide, we're actually losing oxygen too. And so eventually what happens is we get more what's called hypoxia, which is a lack of oxygen. And with inflammation, you also have a lack of oxygen. And that creates a lot of damage because now we're getting fibrosis, we get scar tissue. And then if you get scar tissue in your penis and you get plaquing, then you definitely have circulatory problems, just like in your arteries, right? You don't get blood flow. And so that creates a big problem. The primary thing that really starts this whole problem is insulin resistance. And that has to do with the consumption of a lot of extra sugar and refined carbohydrates early in your life. And it starts to create a lot of inflammation in the arteries. So if insulin increases nitric oxide, and when you eat a lot of carbohydrates, you're increasing insulin, shouldn't that work to your advantage? Well, no, because you develop insulin resistance. As soon as you start increasing insulin more and more and on a regular chronic basis, your body's like, this is too much. We have to block this. We have to create resistance. So now you develop insulin resistance, and now insulin does not work. So in reality, you become insulin deficient when you have insulin resistance. And also the fuel, glucose, that's supposed to be pulled in with insulin doesn't really go in. So we literally start to starve our muscles and our body, and so it doesn't get the fuel it needs. And so the elephant in the room is that we need to focus on fixing this insulin resistance as fast as we can. I'm going to show you how to do that. Another common cause for erectile dysfunction is other medications, especially the SSRIs for like antidepressant, anti-anxiety medication. Wow, do they create a lot of problems with erectile dysfunction and many other related issues. Also beta blockers, that's for blood pressure, diuretics, 5-alpha reductase inhibitors. These drugs are mainly for prostate enlargement or hair loss, but they have a side effect of creating erectile dysfunction. So now let's dive into the protocol. How do we increase nitric oxide? Because that's immediately going to increase more blood flow and help erections. Apparently, beets are at the top of the list to increase nitric oxide because they're loaded with nitrates. And I'm going to recommend them because they're a natural source. You can actually eat beets. You can also have beet juice powder because it's super concentrated. Out of all the things you can do to increase nitric oxide, beets are at the top of the list at 200%. But I lied. There's something even higher. That's arugula. That's more than 200%. However, arugula is usually not eaten in the quantity as you could consume with beets, especially if it's like in a beet powder, a juice powder. So technically, arugula should be up here, but because it's easier to consume more beet juice than arugula salad, I put beets at the top of the list. One thing you should think about is just doing a arugula beet salad on a regular basis, okay? And then number 3 is exercise. Exercise is a very potent way to increase nitric oxide. Now think about this too. When you're increasing nitric oxide, you're also improving insulin resistance as well. And this is why even after a single workout, you see great improvements in insulin sensitivity because of the spike in nitric oxide. 80 to 100% increase in nitric oxide after an exercise. Now, what type of exercise would be best to increase nitric oxide and testosterone? It would be either a high intensity interval training or the resistance training. Not running a marathon, because with marathons, you're going to increase more cortisol, but a long walk would help you, but really it's the intensity of exercise. Now, I want to add something else. This is like a really amazing additional thing you can do to your exercise to take it to the next level, okay? I don't know if you've ever heard of intermittent hypoxia training. Hypoxia meaning low oxygen. It involves wearing a mask to restrict your air simulating high altitude training. Because when you're climbing a mountain, there's lower amounts of oxygen at that level. And so if you work out with this mask and you're restricting just, it could be 10 to 15 to 20 seconds of air, bringing it down to a certain degree, and then you're taking it off and you're exercising back and forth. There's a whole technique to this. You're going to stimulate more capillary growth to the entire body. Because think about what we're dealing with. We're dealing with a circulatory problem. We're dealing with a lack of blood flow in certain parts of your body. And so anything to improve overall systemic blood flow would be really, really important, not just for your private parts, but for your heart as well. So I would recommend looking into this right here. Intermittent hypoxia training. It can just add that extra benefit for many different things. There's also something called L-citrulline. Now, without giving you a lot of complexities, there's a precursor thing that turns into nitric oxide, and that's called arginine. And people take it to increase their nitric oxide, but the problem is it goes through your gut and your liver, and it tends to break down relatively quickly. But if you take L-citrulline, it doesn't go through the normal pathway. It goes right to your kidneys, and you increase more L-arginine more than taking L-arginine. So you're actually going to make more nitric oxide, and it's going to stay in the body longer if you take this supplement right here. And when you take it, you maintain higher levels of nitric oxide for 3 or 4 or 5 hours. So what you'd want to do is take it in the morning and take it in the PM, okay, in the evening, to really boost that nitric oxide. All the things I'm suggesting are not going to be as potent as Viagra, but that's okay, because when you have something that potent, it comes with a package. It comes with side effects. You're not going to see the same side effects with these natural things as you would a drug. Even if you're 50 years old and your nitric oxide is at 55%, and then you take these things right here and you boost it, it could actually bring it up to 100% and resolve the problem. Next one is pomegranate. You can increase it by 30%. You might at dinner just include as your dessert a pomegranate. You can also do pomegranate supplements or powder. And then we get dark chocolate, 85%. Now they have also 100% cacao in a powder. You can add that to your coffee in the morning. I do that. I like it because the flavonoids in this concentrated dark chocolate will increase nitric oxide by 25%. Now, when I talked about Viagra, I talked about the mechanism of how it works. It prevents something from breaking down. So I looked up alternatives to Viagra, which are basically called PDE5 inhibitors. And I found a series of them that will not only mimic the mechanism, but will also increase nitric oxide, because Viagra does not increase nitric oxide, but these do. The first one that is most researched is called horny goat weed. And I will put a link down below of some research, human research, to show that this has a significant effect of increasing nitric oxide and also improving erectile dysfunction. One of the problems with horny goat weed is it's not very bioavailable. So when you're taking it, your body doesn't absorb as much as maybe you would like it to absorb. How do we increase the bioavailability? It's fat soluble, so you want to consume it with fat or your meal, okay? You can also add that black pepper to increase the absorption as well. The next one is Panax ginseng. This will increase nitric oxide and also decrease the loss of nitric oxide. When they did the studies comparing to a placebo, this showed significant improvements. The next one I'm going to talk about is saffron. Saffron does trigger a mild increase in nitric oxide, but it does some other things as well. It works on the central nervous system, especially on your mood and your neurotransmitters. So if you are slightly depressed or have anxiety, that's probably the one that you might want to focus on. And then we get to ashwagandha. This is an adaptogen. I normally recommend this for the adrenals because it lowers cortisol and it increases testosterone, but it also increases nitric oxide. So as I go through these, you want to kind of just see which one matches your condition. Do you have more stress? Do you have more depression or not? And then you can take whatever you need accordingly. And ashwagandha works really good if someone's going through stress because it increases the tolerance to stress. If you have known arterial problems, let's say you have diabetes or you have a history of heart problems, and you've had it for a long time. You may have fibrosis and plaquing. They can do certain tests, I think ultrasound tests and other tests, to actually visualize plaquing in your penis. If you have that, there is something else that you might want to consider. It's called shock wave therapy. It creates this vibration. You actually apply it to your penis and it actually breaks up scar tissue. So there's some really interesting research on that. But again, you only want to take this if you have the problem that this deals with. So if you don't have fibrosis and you don't have this endothelial issue, then it's not going to really work, but it can stimulate more growth of capillaries and things like that. All right, number one, fix insulin resistance. You need to go on a low-carb diet, cut out the sugars, cut out the starches. Now, what's interesting about insulin resistance is that that develops for 15 to 20 years before you even become a pre-diabetic. So a lot of people consume a lot of sugar. You can't really depend on this test called the A1C. That's a measurement of 3 months of blood sugar. If that insulin is pulling the sugar out as fast as you're eating it, especially in the earlier stages of insulin resistance, it might show normal. One of the best tests to do is a fasting insulin test, okay? That'll really show you the picture of what's going on well before you get prediabetes. So you want your fasting insulin to be below like 7 or even below 5. Mine is at 2. I like to keep it really low. I don't have a lot of sugar in my diet. Number 2, arousal. To trigger erections, there are various things that involve your eyes looking at something, your skin, touch, which by the way is the most powerful stimulus, your mind, and even a scent. When you get aroused, you have these triggers that trigger what's called the parasympathetic nervous system. But it's the parasympathetic that triggers this nitric oxide, okay? So in other words, if you're trying to get an erection and you are under stress, it's just going to shut things down. There's a couple little things that you might want to do to quickly put your body into the parasympathetic mode. Nasal breathing. Breathe out of your nose slowly. It's going to increase more CO2, which is going to increase more oxygen, and it's going to pull you out of the sympathetic and put you into the parasympathetic. Nasal breathing, okay? And making sure your breathing is very even and relaxed. It's going to pull you out of the sympathetic nervous system and it's going to help you increase nitric oxide. We've already talked about exercise, okay? We talked about intermittent hypoxia training. There's cofactors that you want to make sure that are in your diet. Zinc, not just for increasing testosterone, but also to help with insulin resistance, to help with erectile dysfunction, probably one of the most important minerals. The B vitamins are cofactors, very, very important to actually beef up or increase nitric oxide. Then we have vitamin D, which is very important in increasing nitric oxide, probably more than any other nutrient. Number 6 is not sleeping. When you don't sleep, you're creating stress and you don't let your body build up the reserve of nitric oxide. For years, I pushed myself to try to get more things done. And I would wake up at 4 o'clock in the morning. It was the worst thing I could have done, especially for my vascular system and my overall health, and nitric oxide. So sleep is super important. In fact, you can do all these things right here. And if your sleep is not good, if you're not sleeping at least 7 to 8 hours, then none of these are going to work. Sleeping in a cooler temperature is going to be very, very important, especially at night, because that cooler temperature will push you into the deeper sleep. Pink noise is probably one of the best things to induce a deep sleep, more than white noise. And then number 7, if you're consuming alcohol, that can nullify your benefits, okay? With testosterone and also erections. Seed oils go into the membranes, into your blood vessels, and they make things very inflamed. So you want to get off the seed oils as well and increase the omega-3 fatty acids from fish oils. Very important. Cod liver oil is one of the best because it gives you vitamin D and vitamin A with the omega-3s. So this is really important, but you might not notice the results right away when you take omega-3. It's more of a long-term game to improve and replace all the seed oils. And of course, if you're smoking, all that smoke goes into your lungs, ends up in your arteries, and really shutting down your nitric oxide. Cold therapy, going to a cold immersion or a cold shower, help push the blood out of that area and create a vasoconstriction. And then there'll be a compensation, a vasodilation right after that to increase circulation in your private parts. And this is another therapy that's been tested and researched, and there's some interesting data behind that. Now, I wanted to add something to this video, very important. What I did is I went through all the credible randomized control studies looking for what has the greatest impact on improving erectile dysfunction, but mainly for lifestyle changes, natural things, nutrition, etc. And some of these interventions I have not talked about, so I'm going to add them right now. There's 8 of them, starting with number 1, intensive lifestyle activities combining exercise, weight loss, and a healthy diet. Number 2, Kegel pelvic exercises. Apparently, that creates a lot of blood flow in the pelvic area, and it helps to trap some of the blood in the venous system. And it's also good for urination dribbling. 40% regained normal erections, 34.5% improved, and 25.5% had no change. 40% regained normal function? That's huge with just an exercise. It doesn't cost anything. Number 3, regular aerobic exercise. That means consistent exercise over a period of time. Number 4, L-arginine plus pycnogenol together. Number 5, Panax red ginseng. And number 6 is niacin. That's vitamin B3. Number 7, treating sleep apnea. And number 8, acupuncture. But before you go, this right here, sleep, is super, super important. And I just want to make sure that you're sleeping at least 8 hours every single night, and you know exactly how to do that. And for that information, I put this video up right here. Watch it right now so you have that information too.